The Occupational Safety and Health Administration, OSHA, has recognized that some employees face a significant health risk as a result of occupational exposure to blood or other potentially infectious materials. In 1991, OSHA issued the Bloodborne Pathogens Standard 29 CFR 1910.1030, which applies to all employees who can reasonably come into contact with human blood and other potentially infectious materials, or OPIM, in the course of their job activities. The standard was revised in 2001 by the Needlestick Safety and Prevention Act to reflect more specific safeguards in reducing the incidence of needlestick injuries on the job. The purpose of the standard is to protect employees by minimizing or eliminating occupational exposure to bloodborne pathogens, disease-carrying microorganisms that can be found in human blood and other body fluids. The Exposure Control Plan is the heart of the standard. This document, which each facility must write, is an action plan to reduce employee exposure to bloodborne pathogens. The primary bloodborne pathogens are hepatitis B virus, or HBV, hepatitis C virus, or HCV, and human immunodeficiency virus, or HIV. While HBV, HCV, and HIV are the primary bloodborne pathogens the standard recognizes, other serious diseases include the West Nile virus, syphilis, tuberculosis, and influenza. OSHA has concluded that employers can minimize or even eliminate occupational bloodborne hazards by developing and enforcing a combination of exposure control strategies, which work for all bloodborne diseases. Annual training must be conducted for all employees with occupational exposure. This program covers the hazards associated with potentially infectious material and the protective measures that you can take to minimize your risk of exposure. In order for a pathogen to cause a disease or infection, there are certain conditions that must be met. This is sometimes referred to as the chain of infection. A pathogen must be present. There must be an adequate quantity of the pathogen to overwhelm the immune response. There must be a suitable entry site for the pathogen to enter the body, such as a break in the skin or the mucous membranes of the mouth, nose, or eyes. The person must have a susceptibility to the pathogen, such as a weakened immune system or a pre-existing condition that makes a person more likely to become infected. Exposure to a pathogen does not mean that a disease will occur. It depends on whether all conditions of the chain of infection are present. By eliminating at least one condition, infection will not occur. The hepatitis B virus, HBV, is one of the primary causes of hepatitis, an infection that causes inflammation of the liver. Complications of hepatitis include cirrhosis of the liver, liver cancer, and liver failure. There is no known cure for HBV. In the U.S., approximately 15 to 25% of people infected with HBV will die as a result. Symptoms of HBV infection include loss of appetite, fatigue, fever, nausea, vomiting, abdominal pain, or joint pain. Jaundice, a yellowing of the skin, can also occur in a more serious phase of HBV. About 40 to 50% of individuals infected with HBV show no symptoms. But even without symptoms, HBV-infected individuals are still infectious to others. Indirect exposure from contaminated objects is a risk with HBV because it is possible for HBV to remain infectious for up to 7 days in the presence of dried blood. A vaccination to prevent HBV infection is available. It has relatively few adverse side effects and is well tolerated by most of the population. Another form of hepatitis, the hepatitis C virus, or HCV, can cause severe liver damage in a manner similar to HBV. About 10,000 people each year infected with HCV die from the consequences of its long-term effects. Chronic HCV patients rarely display symptoms. Symptoms that may appear include flu-like symptoms, nausea, abdominal pain, and jaundice. However, just like HBV, HCV-infected individuals are still infectious to others whether or not they show symptoms. Until 1992, a reliable, specific blood test for hepatitis C was not available, and blood donation agencies did not screen donors for the hepatitis C virus. Many HCV infections occurred as a result. Currently, there is no immunization available for HCV, but treatment is available to get rid of the virus. The human immunodeficiency virus, HIV, is the virus responsible for causing acquired immunodeficiency syndrome, or AIDS. Identified in the mid-1980s, the HIV virus attacks and suppresses the immune system. It specifically targets the cells that are crucial for fighting infection from invading organisms. This allows other diseases and infections to progress in the body without resistance. It could take many years before an HIV-infected person shows symptoms of disease. These symptoms include enlarged lymph nodes, lack of energy, weight loss, frequent fevers, persistent or frequent yeast infections of the mouth or vagina, persistent or frequent skin rashes, and short-term memory loss. While there is no immunization or known cure for HIV, effective new drug therapies keep HIV-infected persons healthy longer and have dramatically reduced the death rate. Of the three major bloodborne pathogens, HBV is the most contagious, with about a 1 in 3 chance of getting infected from being exposed. HCV has the next greatest risk of transmission, about a 1 in 50 chance of getting infected. Comparatively, HIV is much less contagious than either hepatitis virus, with a risk of transmission of about 1 in 300.
Oh, that's an accident then. Okay. Mark, can I help you? Yeah. All right, grab a seat. All right, Mark, I'm trying to stop the bleeding. If I press down too hard, let me know.
The transfer of bloodborne pathogens occurs through exposure to infected body fluids. Body fluids, which can transmit bloodborne pathogens, include blood, cerebral spinal fluid, and breast milk. Semen and vaginal secretions can also transmit bloodborne diseases, but only during sexual contact. Some body fluids, including sweat, saliva, urine, and feces, have no documented risk of transmitting bloodborne pathogens when there is no visible blood present. However, in an emergency, you may not always be able to tell which fluids you are handling or whether injury has mixed them with blood. Therefore, it is best to protect yourself from all body fluids. Casual social contact, such as shaking hands, hugging, or sharing a telephone or tool, does not transmit bloodborne pathogens. The two most common ways bloodborne pathogens are transmitted are sexual contact and sharing hypodermic needles. The primary ways bloodborne pathogens are transmitted in an occupational setting are through a puncture wound from a sharp, contaminated object, such as a syringe or broken glass, and from a splash of blood to the mucous membranes of the eyes, nose, or mouth. Direct contact with blood or other potentially infectious materials can certainly cause exposure. Indirect contact with an intermediate object, such as a work surface or doorknob that has been contaminated with body fluids, can also cause an exposure incident. Some diseases are spread through airborne and droplet transmission, especially in close proximity. Examples include tuberculosis and influenza. Understanding how pathogens are transmitted will help you lower your risk of exposure and infection. A written exposure control plan outlines the strategies necessary to eliminate or minimize employee exposure to blood and other body fluids. Every organization with an identified risk must establish an exposure control plan. This site-specific plan defines which employees are covered by the OSHA standard, how to minimize risk of exposure, and how to deal with exposures after they occur. The plan includes the identification of job classifications in which there are tasks and procedures that increase the risk of exposure to blood and other potentially infectious materials. Also included in the plan are site-specific methods used to reduce the risk of occupational exposure. Engineering and work practice controls consist of procedures to help you complete your job tasks with a minimal risk of exposure. Personal protective equipment isolates your body from contact with potentially infectious material. Housekeeping protocols keep potentially infectious material from lingering on surfaces. And proper containment and labeling of potentially infectious material ensures that these items are handled appropriately. Another key part of the plan includes listing the site-specific means by which the facility will reduce employee risk. These methods include appropriate training, the communication of hazards, hepatitis B immunization for any employee who has occupational risk of exposures, methods for post-exposure evaluation and follow-up, and proper record keeping. The final part of the plan describes the procedure for the investigation and evaluation of circumstances surrounding exposure incidents in order to quickly provide effective follow-up care to exposed employees. This investigation will also help each site team learn from accidents and establish measures to prevent them from happening again. The written exposure control plan must be accessible to all employees. It is reviewed and updated at least annually, or when new procedures or changes in procedures create the possibility of new occupational exposure. Each employer must identify job classifications in which employees have occupational exposure, as well as the associated tasks and procedures in which there is a risk of exposure to blood or other potentially infectious materials. Occupations with a likely chance of occupational exposure include first aid providers, housekeepers, lab workers, firefighters, EMTs and paramedics, law enforcement agents, medical and dental personnel, and tattoo and body modification artists. If an occupational exposure does occur, it is important for you to follow the employer's written procedures for handling medical self-care and evaluation, as well as for documenting the circumstances of the exposure. The recommended infection control concept, called standard precautions, advocates that everyone's blood and body fluids be considered potentially infectious. This eliminates the need to determine individual risk. Engineering controls reduce exposure in the workplace, either by removing or isolating the hazard, such as providing an appropriate disposal container for needles. Your employer is required to examine and maintain or replace engineering controls on a regular basis. Work practice controls focus on the manner in which tasks are performed. For example, using personal protective equipment such as disposable gloves when performing emergency care is considered a work practice control. Perform all actions involving blood or other potentially infectious materials in such a way as to minimize splattering, splashing, and spraying. In locations where potentially infectious material may be found, safe work practices include no eating, drinking, smoking, applying makeup or lip balm, or handling contact lenses. In healthcare facilities, employees are prohibited from wearing artificial nails. Your employer must provide you with readily accessible hand-washing facilities or provide antiseptic hand cleanser or wipes if hand-washing facilities are not available. Perform hand washing immediately after any exposure, even if you were wearing gloves when the exposure occurred. Vigorous scrubbing with soap and running water for at least 20 seconds is the most effective method to reduce the spread of pathogens. Be sure to scrub the backs of your hands, between your fingers and thumbs, and under your nails. Rinse your hands thoroughly. Dry your hands with the disposable towel, and use the towel to turn off the faucet. If soap and running water are not available, remove any gross or visible contamination before using alcohol-based foam or gel hand sanitizers. Practices that are prohibited in the workplace include bending, recapping, and removing contaminated needles, shearing or breaking needles, and mouth pipetting or suctioning by mouth of potentially infectious materials.
When's the next shipment getting in?
Anytime. That's why we need to get this done as quick as we can. Ah, nuts! I cut myself. I think it's pretty deep.
Personal protective equipment, PPE, is specialized clothing or equipment that protects you from exposure to blood or other potentially infectious materials. Examples of PPE include disposable gloves, protective face shields, and resuscitation masks or CPR barrier shields with one-way valves. Effective personal protective equipment must not permit potentially infectious materials to pass through or reach your skin, eyes, mouth, or clothes under normal conditions of use. Your employer must make PPE available to you in the appropriate size and at no cost. Non-latex alternatives must also be made available to employees who have allergic sensitivity to latex. Disposable gloves should be a standard component of emergency response and first aid equipment. Always wear gloves when there is a possibility of hand contact with blood or other body fluids. Replace gloves as soon as possible when torn, punctured, contaminated, or if their ability to function as a barrier is compromised. Remove contaminated gloves by turning them inside out. Be careful to prevent any splashing or spraying of blood or other body fluids. Wear face shields when splashes, sprays, spatters, or droplets of infectious material pose a hazard to your eyes, nose, or mouth. Use a resuscitation mask or CPR barrier shield with a one-way valve to prevent an exposure when performing rescue ventilations during CPR. Place contaminated protective equipment in appropriately designated areas or containers for cleaning or disposal. Never wash or decontaminate disposable gloves for reuse. Your employer is required to offer you a free hepatitis B vaccination series if you have a risk of occupational exposure to blood or other potentially infectious materials. You must be offered the vaccination before you undertake tasks that expose you to potentially infectious materials at no cost to you and at a reasonable time and location. The hepatitis B vaccine is very effective in protecting against the hepatitis B virus. About 97% of people who receive the vaccine will become fully immune to hepatitis B. The vaccine is safe with very few adverse reactions. A licensed physician or other healthcare professional must perform or supervise the vaccinations. Your employer does not have to offer you the vaccination series if you have previously received the complete series or have tested as immune to HBV. You can decline the vaccination for hepatitis B after being informed of the risks and benefits. To do this, you must sign a declination form. If you initially decline the vaccination for hepatitis B, you can later request it from your employer at no charge. If an exposure occurs, immediate self-care is the first priority. Flush potentially contaminated material from the affected mucous membranes of the eyes, nose, or mouth with large amounts of running water. Irrigate a puncture wound from a potentially contaminated sharp object with large amounts of running water and wash the wound with soap and water. Wash potentially contaminated material off your skin with soap and water as quickly as possible after an exposure. Washing is especially important when you have cuts, rashes, scrapes, or breaks in your skin. After you have accomplished immediate self-care, report the exposure incident without delay. This allows for timely testing of the source individual and, if necessary, the employee. You will be directed to a healthcare professional for medical evaluation as soon as possible. The evaluation will document the route of exposure and how the exposure occurred. There is no cost to you for this evaluation. If you've been exposed to HIV-infected blood, most medical facilities offer short-term therapy called post-exposure prophylaxis, or PEP. This therapy must begin as soon as possible after the exposure. PEP can reduce the risk of getting HIV by as much as 80%. Healthcare professionals conduct the evaluation according to the Centers for Disease Control and Prevention guidelines for testing for HIV, HBV, and HCV. The evaluation will also include counseling and education regarding the testing process and the ramifications of exposure. This includes safe sexual practices information for the 3-month post-exposure evaluation period. The result of testing is confidential and will be reported only to you and your physician. Your company's designated representative will receive a list of recommendations, but not diagnostics or test results. No other person will be notified. The term regulated waste refers to specific categories of waste that require special handling, including blood and other potentially infected materials. Regulated waste that warrants special handling includes liquid or semi-liquid blood or other potentially infectious materials, contaminated items that would release potentially infectious material in a liquid or semi-liquid state, items caked with potentially infectious materials that are capable of releasing these materials during handling, and contaminated sharp objects. OSHA defers to state laws for specific procedures for containing, labeling, and handling regulated waste, including contaminated laundry and sharps containers. It is of the utmost importance that infectious waste be safely contained. It should be placed in specially designed containers constructed to contain the contents. The containers must be leak-proof, labeled or color-coded, and closed prior to removal to prevent spills during handling. If a container is leaking, place it in a secondary container with all the appropriate safety requirements prior to moving, storing, or shipping it. The term contaminated laundry refers to laundry that is soiled with potentially infectious material or that may contain sharp objects, such as needles. Contaminated laundry must be handled as little as possible and be placed in labeled, leak-proof bags or containers before transporting it. Gloves should be worn when handling contaminated laundry. Do not take contaminated protective clothing home for laundering. Your employer is responsible for maintaining protective equipment. Pick up potentially contaminated broken glassware using mechanical means only, such as tongs, forceps, or a brush and dustpan. Never use your hands, even if you are wearing gloves. Contaminated items must not be stored or processed in a way that requires you to reach into containers where the contents cannot be seen or safely handled. All equipment and work surfaces that could become contaminated must be cleaned and decontaminated routinely using an appropriate disinfectant. All potentially contaminated work surfaces should be routinely decontaminated with an appropriate disinfectant while wearing PPE. All pails, bins, and similar reusable receptacles must be decontaminated on a regularly scheduled basis and as soon as possible after visible contamination is noticed. Signs and labels that alert you to the presence of potentially infectious material and the risk of exposure are vital to a workplace with occupational exposure to potentially infectious materials. Be sure that you are aware of and abide by all signs and labels signaling hazards and hazardous material. Signs should have a fluorescent orange or orange-red background with a black biohazard symbol in the foreground. Labels must contain the biohazard symbol and must have the word biohazard written on them. A biohazard label or sign must be attached to each object or container of contaminated material by string, wire, adhesive, or another method that prevents loss or unintentional removal of the label or sign. When red bags or containers with the biohazard symbol on them are used, An additional sign or label is not necessary. Also, when medical laboratory personnel are drawing and testing blood samples, the individual containers housing potentially infectious materials do not need to be labeled. Properly indicating contaminated material using labels and signs will greatly reduce the risk of accidental exposure to the contaminated material. It is important to maintain appropriate container labeling at all times. By consistently using engineering and work practice controls, personal protective equipment, exposure follow-up, and proper housekeeping procedures as outlined in this program, you can help reduce or eliminate your risk of being exposed to potentially infectious materials in your workplace.